Hello, gentlemen. If you're over 50, 60, or beyond, and you've noticed that your moments of intimacy feel different, specifically if you experience the full sensation of pleasure, that moment of climax, but without the expected presence of seminal fluid, this message is absolutely essential for you. Maybe it happened just once and instantly triggered a knot of worry in your stomach. Or perhaps it's a recurring, silent issue you've been keeping entirely to yourself, carrying a quiet sense of shame or a fear about what it might mean for your health. I'm Dr. Jocelyn, a urologist with 12 years of experience focusing on men's vital health at every stage of life. And today, I want to have a serious but profoundly supportive conversation with you. One that I have with my patients every single week, because this is far more common than most men realize and far more manageable than most men fear. First, and most importantly, I want you to know that I understand your concern. The change you're noticing in your body is not a sign that your masculinity has expired or that your intimate life is over. Think of it this way: it's not a failure. It's a detailed message your body is sending you, and that message simply needs to be decoded. Stay with me, because in the next few minutes, we're going to explore the surprising causes, the critical warning signs, and, most importantly, the clear, manageable solutions that modern medicine offers to restore your peace of mind, your confidence, and your overall well-being. Before we dive into what happens when the fluid is absent, let's take a quick, non-textbook look at how this process should work normally. Think of your body's reproductive system as a perfectly timed orchestra. The testicles produce the sperm. The seminal vesicles contribute the bulk of the nourishing, rich fluid. The prostate adds a protective fluid. This final cocktail is gathered and prepared in the urethra. When climax hits, specific muscles contract in a powerful, rhythmic sequence to propel that fluid mixture forward and out. It's a rapid event, the result of delicate, synchronized timing between nerves, glands, and muscles working in complete harmony. Now, here's a crucial distinction I always make sure my patients understand. Climax and ejaculation are not the same thing. Climax is the neurological sensation of intense pleasure governed by your brain and nervous system. Ejaculation is the physical act of expelling the fluid. Most of your life, they happen seamlessly as one event, but they are driven by entirely separate mechanisms. Understanding this distinction is, in my experience, one of the most reassuring pieces of information I can offer a man sitting across from me in my office. Our focus today is on dry ejaculation. This is the clinical term for when a man reaches climax, feels that characteristic pleasure, but notices little to no fluid is released. It's often described to me as an empty orgasm. And that phrase alone tells me how disorienting and worrying the experience can feel. This gap between what's expected and what happens fuels anxiety, and I understand that completely. But here's what I need you to hold on to. Your ability to feel pleasure can remain completely intact, governed by your nerves and your brain. The change is in the mechanical delivery system, not in your capacity for desire, connection, or enjoyment. This doesn't mean you've lost your virility. It simply means part of your body's internal plumbing has a specific, identifiable reason for the change. And identifiable reasons have solutions. Quick pause. Before we count down the main causes, if you find this information helpful, please hit that like button to let YouTube know this video matters to men's health. Subscribe to join our growing community and drop a comment below. Tell me, where in the world are you watching from? I love seeing the brotherhood of men supporting each other across continents. Now, let's break down the 3 most common causes of dry ejaculation. Knowing the why is always the first step to feeling in control. 1. The gatekeeper is too relaxed. Retrograde ejaculation, the single most common cause I see in my practice, is called retrograde ejaculation. Let me explain the biology in a way that makes it easy to picture. Imagine a small, muscular valve, a gatekeeper, sitting at the exit of your bladder. During climax, this valve should clamp down tightly, ensuring the seminal fluid has only one direction to travel, forward and out. If this valve is too relaxed, the fluid follows the path of least resistance and flows backward into the bladder instead. You feel the full pleasure of climax, but since the fluid doesn't exit, the experience feels dry. The practical clue? A common, non-alarming sign is noticing that your urine appears cloudier right after intimacy because the seminal fluid is now mixing with it in the bladder. What causes this valve to relax? This often happens after certain surgical procedures on the prostate or bladder. The surgeries themselves are successful and necessary, but they can affect the delicate nerves controlling that gate. It's also a known side effect of specific medications used to treat conditions like high blood pressure or an enlarged prostate. The medication works effectively on the blood vessels, but it also relaxes that tiny muscle as a secondary effect. I remember a patient of mine, a very proud, private man, who came to me deeply distraught following a successful prostate surgery. He felt broken. But when he understood that what had changed was purely mechanical, like a traffic light being stuck open rather than a failure of his body or his manhood, and that his desire and ability to feel pleasure were completely unaffected, something visibly lifted from him. That is the power of understanding. 2. The plumbing is blocked. Duct obstruction, the second major cause, is a physical obstruction somewhere along the duct through which seminal fluid travels. Here's the biology. The seminal vesicles and other glands are producing fluid normally, but the small ducts that carry it are blocked. Think of those ducts as narrow delivery pipes. If the pipes are blocked, the fluid can't pass through. So the volume decreases dramatically or disappears entirely, even though production is perfectly fine. What causes these blockages? Scarring left behind by past infections is a significant one. For example, a severe or untreated case of prostatitis. In some cases, small calcifications, similar to tiny stones, can form over time and obstruct the passage. The symptoms can be subtle. Some men report a new, mild discomfort in the pelvic region during climax. Others notice that over a long period, the volume of fluid has become progressively thicker and less abundant. The excellent news is that many of these obstructions can be effectively addressed, often with medication to manage underlying inflammation, and if needed, minimally invasive procedures to restore the normal flow. In my practice, I've seen men who thought they'd simply have to live with this change experience, genuine restoration after the right targeted treatment. 3. The fuel is running low. Hormonal factors, the third major area I always investigate, is hormonal, specifically low testosterone. Testosterone is the primary fuel for the entire male reproductive system. It doesn't just regulate desire and sperm production, it's also crucial for the optimal function of the prostate and seminal vesicles, which together contribute the vast majority of the seminal fluid. When testosterone levels drop significantly, the entire system slows down and output diminishes. Initially, you might notice simply a reduction in fluid volume. But over time, this hormonal deficiency can show up as decreased libido, less firm erections, and a generally less intense sensation of climax. On a broader level, men often experience persistent fatigue, mood changes, difficulty concentrating, and gradual loss of muscle mass. These are signals the body is sending, and they deserve to be heard. The condition is called hypogonadism, and it is a treatable hormonal deficiency. A simple blood test can confirm whether your testosterone levels are below the optimal range. If they are, carefully managed hormone replacement therapy can often restore not only better fluid production, but also energy levels, sexual desire, emotional stability, and overall quality of life. I tell my patients directly, it is a mistake to simply chalk this up to getting older and accept it as inevitable. You deserve better than that. Now, while the vast majority of the time these causes are manageable and non-alarming, as your doctor, I must be transparent with you about the exceptions, because caring for you means giving you the complete picture. Dry ejaculation can sometimes be a red flag for a more serious underlying condition, which is precisely why paying close attention to accompanying symptoms matters. When to see a specialist immediately If dry ejaculation appears suddenly and without explanation, especially if it is accompanied by pain, blood in the urine or fluid, fever, or a loss of sensation in the genital area, do not wait. These are signals that require an urgent urological evaluation. Conditions such as certain neurological diseases, including Parkinson's disease or long-standing uncontrolled diabetes, or in rare cases, specific urological cancers, can interfere with the nerve signals or plumbing involved in ejaculation. Early evaluation is always your greatest advantage. The emotional weight, and why it matters as much as the physical, beyond the physical, I cannot overstate the emotional toll that dry ejaculation takes on the men I see. In our culture, many men have deeply internalized the idea that the presence of seminal fluid is synonymous with performance and virility. When it disappears, feelings of inadequacy, anxiety, and quiet shame can take root quickly. It's incredibly common for men to begin avoiding intimacy altogether, out of fear of being judged by a partner, or simply out of feeling incomplete in a way they can't easily express. What I want to offer you here is the most important reassurance I can give. This is a physiological change, not a personal failure. The two things are entirely different, and holding that distinction clearly in your mind lifts an enormous emotional weight. Your ability to feel pleasure, to maintain erections, to be present and connected with a partner, none of that depends solely on the presence of fluid. Your intimate life can and absolutely should remain a source of genuine joy and closeness. Understanding the cause transforms the narrative from one of loss to one of agency. And that shift, from fear to knowledge, is where healing truly begins. Your action plan, taking back control, I want to leave you with a clear, empowering plan. The same guidance I give to every patient who sits across from me. Step 1, don't ignore it, investigate it. A sudden or progressive onset of dry ejaculation warrants a visit to a urologist. A thorough history, a physical examination, and often a blood or urine test are all that's needed to arrive at a clear diagnosis. Knowledge removes fear, and a clear diagnosis opens the door to solutions. Step 2, manage your underlying conditions. Keep chronic conditions like diabetes, high blood pressure, and elevated cholesterol in check. These conditions directly impact the vascular and nerve health that governs the entire process. Taking those conditions seriously is an act of self-respect. Step 3, break the silence. Talk openly with your partner and your doctor. I know this is not easy for many men, but talking about what you're experiencing is not weakness. It is wisdom. It is liberating. And it paves the way for real solutions. Whether the answer is a medication adjustment, a targeted treatment, or hormone therapy, professional support is your most powerful tool for restoring confidence and comfort. In summary, gentlemen, the absence of ejaculation is not the end of your intimate life, and it is not a verdict on your masculinity. It is a signal from your body, one that deserves to be heard, respected, and investigated with the guidance of a qualified professional. Understanding whether the cause is mechanical, obstructive, or hormonal is the critical first step toward peace of mind. In my years of practice, I have had the privilege of watching countless men walk out of my office with clarity, relief, and a renewed sense of themselves after years of carrying silent worry alone. That transformation is always deeply meaningful to me as their doctor. Your vitality is not measured in milliliters of fluid. It is measured in your health, your well-being, and your capacity to live fully and connect deeply with the people who matter to you. You deserve answers, you deserve support, and you deserve to move forward with confidence. Don't let doubt or shame stand between you and the care that could change everything. Acting in time is always worth it.